All right, so this is actually something that I put together for the ER residents, and I used to give this every year for a while. I haven't done it for them for a couple of years, so I've been now using it for us. These first few slides are very introductory, so we're going to kind of skip all these. And that's our ER team. This is actually, if you haven't met him yet, that's Dr. Beater, the head of the ER right now. And this actually took years back, a screenshot of it. So that's just supposed to be like what some people that don't do radiology see radiology, right? It's like the plane there, not there, but you don't actually see it. So radiology saves life, blah blah blah. We're gonna skip all these. There's some things in here I have. I'll say a couple of these slides for the students' sake, but hopefully the students have got this over the last couple of weeks, already know this. So in particular with household units, so what I want to say is this is our scale right here with water being zero, because a household unit is just a number that the machine gives us based upon density. Another way to think about it is whiter or brighter something is, the higher it's going to be. So, and then of course something more black like air means no density, and it would be more negative on the scale. So meaning that like air over here was going to be like literally like a negative 1,000, really, and then like calcium or metal is going to be like positive, 600, 800, really high. So looking at that, this is a screen I did in packs. Each one of these little X's just shows the one pixel would be as far as its density. Hold on, I'm going to close the door because patients hallway. Okay, so looking at this is what I said a second ago. Over here, we took the measurement of air. It's like almost negative 1,000. Here's fat, because fat is not as dense as next, which is muscle. It's positive 60. And here I did bone, and notice the bone here it's 200, here it's 700, because one is on cortical bone and one's on medullary bone. So if I did metal, which is not in this picture, metal would literally be like thousands. So just to give you a basic idea for that. So Windows is another thing we use Windows. That's just a change in the settings of telling where the machine to focus on, what level, sure, it's a what color gray, we call it levels. And this is one window here, so a standard abdominal window. This is now changing to a more narrow window, and you can see now in this person, same cut, right, just different picture, but you can see now that they actually have cholelithiasis and 11 degree of gallbladder, which you don't really see so well in the normal window. So that being said, also we use Windows a lot of times for abdominal imaging to exclude things like pneumoperitoneum. You might not notice it that well right there. Obviously, going up and down would be a little bit easier. Here's now the same person on a lung window, and we can see very clearly that that's not in bowel, right? That's not in bowel. That's not in bowel, etc. But we can always do 3D recons. That's actually a really bad 3D recon because it was on a single slice machine, so a good image. But that was a person who jumped off a building, landed on their face. So that's this big dislodged flap right there. And we do the 3D recons all the time. So contrast indications, really, this is easy to. So anyway, I was going to say contrast indications usually. So this whole lecture is going to be trauma, or cases I'm going to show what we're going to do in an interactive way, but is for trauma. So with abdominal trauma and chest trauma, you really should be using IV contrast. That's the national standard. At the double AST, that's the way it's supposed to be done, and that's what we do here as well. So here's really the only indications in abdominal CT to not use contrast, so IV contrast. Renal stones, obviously, because you can mask them because, right, a renal stone is white, right, because it's dense on CT. And of course, IV contrast is also white. So if you put white in the kidneys, right, or ureters because it's contrast and there's a white stone there, it's going to be really hard to see. Retrocranial hemorrhage is really going to be like a shape or attenuation of the retroperitoneum. We don't need contrast for that. Of course, pneumoperitoneum, like I showed, contrast isn't really adding anything to that every time we go out pneumoperitoneum metric. So other than that, we would use contrast. So anyway, CT findings, this is just what, again, for the students quickly, how we'll be describing the cases, where we talk about things in either hyper or hypo attenuation. So hypo meaning dark. Laceration going through the spleen like that. Notice that we keep fluid around it. And the key thing with this is look at the color of this fluid and compare it to the fluid over here, right? So what I mean is that fluid around the liver is more normal. And what I mean is if you put a house unit where my circle is, you probably get like 10, maybe max closer to 20, but it's still normal fluid. Remember, normal fluid is 0 to 20. Whereas if I was to look at an ROI, right, in a household unit in this area, right in here, I'd probably get more like 50 or 60. So what I'm getting at is that the fluid around the spleen is actually blood, with hematoperitoneum in this case. So this is one they'd have to watch closely as well because they could definitely drop their H and H very quickly. Right, case number 2, Mac, you're up.
So we have a chest CT, axial view at the level of the aorta and arch. uh, or just at the level of the aorta. Mediastinum looks. Well, we have a pleural effusion on the left. Small
Remember,
pleural
these are all
effusion.
trauma cases that we're doing today.
So it's
Anything else?
most likely like hemothorax.
Why do you say that?
Because I believe that fluid is going to be more blood. Given the
Yeah, and
context
if you
of
look
trauma.
closely, there's a bright spot kind of just floating on top of it right there. See that little bright wafer?
Absolutely.
That right here.
Yeah.
Yeah. Anything else
So,
about this image?
yeah. So
Uh-huh.
the mediastinum looks a little abnormal here. Usually you have
You are correct.
cytokines,
Exactly.
and this is more the whole mediastinum is much more hyper attenuated.
So what does that mean? You are correct.
So there's hemorrhage, active hemorrhage into the mediastinum that's like layering in the mediastinum. That
all of that area encircled, right, should be fatty or dark like this in this armpit over here, axilla. So all of that area. So we have a significant problem here, right? So we've got a complex left hemothorax. We also have blood layering in the mediastinum. And if you look closely, obviously bone window, but this bone does not look normal, right?
No, it does not.
More like a perfect little box or rectangle, and it is not. So I think I have a bone window for you, and you can see there really nicely the sternal fracture that's sitting there. So, good.
Absolutely. Absolutely.
The other thing you have to say on this case, you'd have to say because of the mediastinal hematoma, you have to exclude great vessel injury. So you look at those vessels very closely, make sure one of them not leaking.